So my name is Eleanor Rivoire, and the position I hold at Kingston General Hospital is as the Vice President for Clinical Administration and Professional Practice, and I'm the Chief Nursing Executive. For this particular project, I'm the project lead for a team that we're calling the Maternal Newborn team. What we learned through the review of data is that we had some real variations in the cesarean section rates. I think there was a sense that there was newborns of low birth weights in some organizations, not in others, and raised the questions about where's the care being provided for certain patients, and also the question of what were the standards or protocols that were guiding where certain activity was occurring. Newborns who are born in one hospital but require services in another that were being transported. We had newborns of a very high risk that weren't able to sort of gain access to a tertiary care or a level 3 institution, and therefore were going out of our LHIN. And we had babies that were had gone through a stage of recovery or treatment and were ready to be returned closer to their home, and we weren't able to sort of support that transfer. So the theme was to get to how do we ensure that we are providing the best care, safest care, quality care. So this patient safety and quality was one of the big overarching themes that came from the 3 task groups. So the 4 priorities that we have identified, and there's a number of components that are within each of these priorities, are the following. The first is that we believe that there should be a creation of a community of practice network where people are voluntarily coming together and saying, with their expertise, what are the things that they think need to be in place, and how do they provide oversight and advice to all of the organizations in providing the best quality and safest care possible. Our second priority is really looking at the scope of services within the LHIN. We've not come to any conclusion or decision on what that will mean in our region, but there's the commitment that we need to be looking at what are sound practices and then making sure that the decisions are made to be sure that those practices are used. The other priority is really looking at the transportation. So it means that if, regardless of sort of gestational age or circumstance, a baby is born in a hospital where that baby's care cannot be supported, how do we best ensure the transportation of that newborn to a hospital that can support the care? So those are the first 3 priorities. The last one is really looking at some of the infrastructure support. So those are sort of what's the skeleton or the foundation that needs to be in place to support that happening. And we know that we need really good data systems to be able to have the information and really analyze what's going on within our LHIN, and to have the indicator information so that we can, as a LHIN, say where are our opportunities for improvement, and if we change something that we have a way of measuring it and knowing that we actually are having the impact or benefit that we think we are. One of the things that we've identified as an infrastructure support would be a regional education system. Within our LHIN, there is a certain number of deliveries, and the delivery number isn't changing dramatically. So we have a set number of providers. The turnover can be fairly low, but we need to look at how can we basically consolidate our resources or the materials that we use for education and training to be sure that staff are well oriented if they're going to be working with the patient population, oriented to the theory and the skills, and that they also have means of maintaining an expertise so that no one feels that they're being called to support care of a patient but not really feeling like they have the skills and knowledge to do that. So those are the 4 areas that we're sort of identifying as our major priorities. There's lots of things sort of embedded in each of those, and the team's going to continue to work to say how do we flesh those out and make recommendations in moving forward. and we would certainly welcome we need the input from the providers within each of the organizations or services that are affected. And then we are going to be very interested in also hearing what the views of the organizations and the public is in terms of what we're looking at